So we know that obesity is not just a disease of willpower. We know that it's a chronic condition and does have genetic predisposition. I do think we can get to a place where people can be healthy, not just physically, but also mentally. Well, I'll give you an example of high blood pressure or diabetes. I'm not just giving medications to my patients, I'm also counseling them about their nutritional habits. When I'm not rested, my workouts are not that great. But when I am rested, I do so much better with my workouts.
I don't know about you, but I don't want to be that mom that's like constantly hounding my son to be like, call me, come home, like be with me. Like I want them to also feel like they have their freedom to be.
And I've always been very protective of my time with my boys and with my family. One of the reasons I'm very careful in expanding any aspects of my career is that time with my children, because I look at that time as I have temporary job with my boys.
Welcome to another episode of the Save Yourself podcast. I'm Dr. Amy Shah, and I am so excited to have one of my closest friends and colleagues, a super mom, a super doctor, here today, Dr. Sonal Haerter. Thanks for being here.
Thank you so much, Amy, for having me. I don't know about the super mom, but I'm just so glad to be here with you.
We'll talk about more about that, but I think the definition for super mom is like someone who really just cares about their kids and puts your best effort. I think there's nothing else that makes you that can make someone super, you know. So before we get started, I wanted to make sure that everybody kind of learns a little bit more about you. We're going to dive into topics about, I want to talk about as much as possible the obesity medicine medications. Lots of people have so many GLP-1 agonist medications, the Ozempics of the world, the Mounjaros.
Yes.
Everyone has tons of questions and loves to hear actual medical insight. So I'd love to hear about that. We'll talk about being mom, going through perimenopause, balancing what we were talking about offline, which is basically how do we find the balance between joy and work and kids and family and ourselves. And then we can touch on some hot topics as well if we have time. So
Sure.
I'm excited.
That sounds great.
So before we get started, I wanted to just share with you that Dr. Sonal Haerter is a double board certified MD in internal medicine and obesity medicine. She's an associate program director at one of the largest programs in Arizona, Creighton Alliance Internal Medicine at Dignity Health. That's like a mouthful. I didn't know there were so many words.
Yes, that's a long, yes.
She's the vice chair of wellness at the Department of Internal Medicine at Dignity Health. She's clinical skills co-director at the Creighton School of Medicine. She's an associate professor. She's a social media subject matter expert. She's a top doctor. She's has gotten many awards for her teaching and her humanism. And I am just so excited to have you
Can
here.
I make one correction?
Yes.
It's assistant professor, so not associate professor.
Assistant
professor for Creighton.
which is amazing. So let's start off with a hot topic because everyone, do you think that obesity medicine medications like GLP-1 agonists specifically can solve our obesity epidemic?
I think they play a huge role in solving the kind of numbers we are looking at obesity. About 70% population in the United States is obese and overweight if you put them together. And the knowledge we have right now about GLPs is powerful. So we know that obesity is not just a disease of willpower. We know that it's a chronic condition and does have genetic predisposition. So we know that there are 50 genes that are actually associated with obesity. So we, along with these medications and lifestyle modifications and proper guidance on nutrition and exercise, I do think we can get to a place where people can be healthy, not just physically, but also mentally. I think oftentimes people forget that just like other addictions and other diseases, this is a condition that requires chronic treatments, long-term treatments, and does require to look at pharmacotherapy as well as lifestyle treatments.
What do you think of people taking it off-label?
I think this is where I have a challenge, understanding. So there, just like any other medication. So let's just take high blood pressure, right? You would not take those medications unless you qualify for the criteria for high blood pressure. Obesity is the same way. There is a criteria for who should be treated, who should be on these medications. And this should be done under the guidance of people who are trained either for obesity or internal medicine or family medicine doctors who have nutritional knowledge as well as can follow these patients on a regular basis, monitor them closely, and not just give them those medications for reasons
Aesthetic
like,
reasons.
4 or 5 pound weight loss. That is not what these medications are designed for.
And just in your opinion, and this does not have to be scientific, why, if someone is just trying to lose 5 pounds and they're listening to this or watching this, and they might be like, so Dr. Haerter, like, why wouldn't I take it? And what would be the downsides?
Because like anything else, these medications do also have side effects, right? So these side effects, some of these side effects are serious. And so you always have to weigh risk and benefit ratio. So in medicine, we don't blindly send people for any treatments. We actually look at a full picture. In what context are we using these medications? What are some risks and benefits? And then we make a shared decision with the patient. So is it worth, are the risks worth taking? And so 4 to 5 pound weight loss may not be worth risking the side effects that come with these medications. But then again, we have to look at a full picture and say, where is the patient in terms of the criteria that we use for these medications? So it's not just 4 or 5 pounds, but definitely do they qualify one of these guidelines for use of these medications?
And then what I've heard from people just anecdotally is that when they stop them, or if they stop them, that they feel like their cravings and appetite comes back with a vengeance, almost like exaggerated. Is that something that you hear?
So based on my practice, but also based on what I have read in literature, there are two. This actually doesn't apply to every patient. Every patient is very different, and how they respond to these medications is different. What is also different is patients who are actually changing their lifestyle, right? So medication is perhaps a huge part of the treatment, but the other part of the treatment is eating habits. What kind of nutrition are you eating, and what kind of guidance are you getting from your doctor about nutrition? What are you eating closer to nature? So you eating fruits and vegetables and whole grains and legumes? Are you working out with an intent of growing, your muscle or working on your muscle strength? All those factors play into this. So what I have noticed in my practice is patients who are actually changing the eating habits. So going from very processed foods to very close to nature kind of foods. They are focusing on eating enough protein, enough fiber. They are working out with intent. So what I mean by that is 2 to 3 days of lifting weights, like progressive loading, not just lifting weights, but they are actually loading heavier weights to get their muscles, built and strengthened. I think those patients tend to do better on lower doses. There is a chance of coming down on the dose of the medications. There's a chance that they might be able to try going off the medications to see what happens with their cravings and with the food noise that we have heard so much about, right? There are some patients who need low dose because that food noise gets exaggerated as soon as you start to back off on these medications. So it's patient to patient, and one formula does not fit everybody.
It's interesting because what I've heard from various patients is that it does a really great job of modifying your cravings and appetite in the beginning, and then that the appetite and craving effect kind of becomes a little less pronounced as they take it for longer term, like a year or more. And I thought that was interesting. Although I think the data shows that they're able to keep most of the weight loss off, but your appetite and cravings may come back a little bit.
And that is one of the problems we struggle with this chronic obesity phenomenon is there is real food cravings that some people experience. And this is where these medications have been actually very impactful. And that's why I have to remind people and even colleagues at times that it is not a disease of willpower. It's not just somebody not having willpower. These food cravings and this food noise is real. It's like any other addiction.
I mean, I'm sure you've seen it. I think just recently I've seen a couple of posts about people saying like, can you believe this is going to be prescribed in children? And can you believe this is going to be Everyone is going to be on it. Like the indications are just like broadening, and there's a lot of pushback in society. What do you think about that?
I think here's what I think about any treatments. You really have to look at what are your options. Nutrition and physical movement and exercise is still not adequately discussed in our practices. Perhaps lack of time or lack of knowledge, but I think that is foundational. We have to talk to everyone about, like, for example, I'll give you an example of high blood pressure or diabetes. I'm not just giving medications to my patients, I'm also counseling them about their nutritional habits. So if someone is a diabetic, I'm talking to them about complex carbohydrates. Are you eating enough fiber? Are you eating enough protein? Because it's not all about just medications, right? Similarly, as far as obesity goes in children, we see this actually in genetic, risk for families. Like several family members are obese, including younger children. And younger children who are obese do land up having chronic medical conditions. So, although I'm not a pediatrician and I, would not comment on treatment for young kids, I see why there is that idea of let's look into it. Let's have more research and studies on treatment for younger kids. So as far as the adult world goes, I do think that there is huge benefit in helping people lose weight with medications, but medications is only half of the problem. I think the second half of this is nutrition, movement, making all these things accessible, and actually educating people on eating appropriately.
Yeah, I think that's what it comes down to. There's a lot of controversy, and I think it'll continue to be. But I just saw a report come out today that showed that Americans, for the first time ever, have not increased in obesity. Like we just got the report, I think it came out in JAMA today,
Yeah.
that there's actually a stagnation in our obesity levels, and that has to be because of some of these medications.
I think that is because we are talking about it so much. I think we are taking the shame of obesity away. We're actually opening the gates and talking to people about how genetics can affect obesity, how it's a chronic condition, why medications play such a huge role, and what obesity does in terms of increasing risk for cancers, increasing risk for heart disease and diabetes and high blood pressure. So we are having more conversations. I think people are open to this concept of we may need medications, and we are trying to destigmatize this disease. Because if you think about obesity, we often thought about this disease as somebody who doesn't have willpower, who's not eating appropriately. And I can tell you something in my practice. I have so many patients who come and say, I have gone on so many diets. I'm not eating more than 1,500 calories. I am going to the gym 5 times a week, and I'm still struggling with weight. I see this almost on a daily basis. So I do think that people do have to look at this as a chronic disease, as well as something that needs a lot of guidance when it comes to nutrition and other aspects of health.
Do you feel like since you and Chuck both got, Chuck is Dr. Haerter's husband, both got obesity medicine certified. Do you feel like it's changed your view on how you personally approach diet and exercise?
Oh, 100%. I think I can tell you one thing about when I was getting, when I was getting ready for the boards, my view about protein intake has changed tremendously. My view on lifting weights and weight training, I mean, as you know, I had not lifted weights at all up until 2017. My idea of physical activity of movement was running or walking on an incline or hiking, and which is all good. I still do those things. I think staying active was something I was always passionate about, but I never bought into this concept of building muscle. And I'm totally into it. I see a difference in my body composition. I see a difference in my energy levels. I see a difference in, overall my cholesterol and my labs. And the big changes I have made is I am eating more protein than I did before. I'm actually mindful of how much protein I'm eating. I should not say more or less, but I'm mindful. And I make sure that I get enough protein for the kind of workouts I'm doing. I am lifting 4 times a week, and I am staying active. I'm taking steps. I'm not doing intense cardio, but I am doing sprinting or, those intermittent high intensity workouts once or twice a week. So from that standpoint, both Chuck and I have changed our
Do
lifestyle.
you guys still go to the gym for 5 times a week, or what time? How
So
many?
I train at the gym, like I do weight training 4 times a week, 45 to about 55 minutes. And then I do 2 days of either sprinting or hiking or something that has a little bit of cardio, a little bit of moderate intensity cardio. So
And then 1 day off.
one day off, one day, and that's another thing I've learned is rest is just as important. When I'm not rested, my workouts are not that great. But when I am rested, I do so much better with my workouts.
I definitely agree with that. What's happened to me, and I share this with you a little bit, but I think now that we're talking about it, I honestly think that this year has been the hardest year for me to kind of figure out how to fit in all of that weight training with the busyness of life. Our
Right.
kids are both of our kids are both two kids in high school, changes in career, travel. I have noticed it being the most difficult year. And so I have had to kind of pare down. Like, I love to work out. I know you do too. But I've had to pare down my routine, and it was really, really difficult to figure out what to pare down.
Sure.
Because I think, when time is unlimited, I want to work out all the time, but it's just not. And so I've had to kind of make hard decisions. And so for me, I prioritize walking every single day. That's like a non-negotiable. And I think I learned that from our fitness. I didn't walk 10,000 plus steps before we went on our fitness. For those of you who don't know, Dr. Sonal and I and our husbands all kind of went through this fitness journey, where we were counting macros and eating a lot of protein and working out. And until then, I didn't really know the power of walking.
Correct.
And I knew about it like intuitively.
Sure.
Like, I knew my grandfather lived so long because he walked a lot, but I didn't really incorporate it as a part of my workout routine. Now it's like the base of my workout, like my exercise routine. And I think I've had to kind of figure out what is actually the most important. So I just do kind of, I have like a 4-3-2-1, 4 days at least of walking. So any kind of low impact zone 2 cardio, 3 days of weight training, 2 days of hot therapy, like hot yoga or some kind of hot workout, and then 1 sprint a week. That 1 sprint a week is like super hard.
Yeah.
But I make myself do it. And it's often super short, like up to 4 minutes or something. But I've had to kind of like, really think about what things I'm going to be doing. It's not as easy as it was before. I'm actually really, really loving yoga and Pilates these days. I don't know if you do any of that, only because yoga for me is a mindset kind of.
Yoga is a mindset. And, I have attempted to get into yoga multiple times in my life. And I am not sure why. I have not enjoyed yoga as much. And I think a lot of people are not going to like this. But
No, yeah, you
more
have to
for
do
me,
you.
I
Yeah.
think I just haven't enjoyed yoga as much as I enjoy some other forms. Pilates, though, I do actually enjoy Pilates.
Yeah.
And one of my good girlfriends actually does Pilates twice a week along with weight training. And she has been sort of like asking me to go with her. Might do that this upcoming year. But I also have to keep it realistic about how much time. As you
Yes.
know, most of us, who have busy schedules and just kids at home and, whatever activities we have, I have to keep it realistic and I have to say I need 4 days of weight training. And then the other 3 days really are something that I just kind of customize it based on what I feel like and, what time permits. But one of the things that I wanted to emphasize and highlight was what I did not realize about these workouts, the structured workouts, is how much it has helped me with my anxiety and my mental health. So, as you know, this year I had this big surgery on my leg, and as part of the recovery, I was not able to work out for 6 weeks. It was a big incision. I was healing from it. And I could clearly tell how significant workouts are for my mental health, even more than physical health. I have noticed a reduction in my overall anxiety And when I was not working out, when I couldn't work out for those 6 weeks, it definitely took a toll on my mental health. And so I think for everybody, like it could be a walk, it could be walking with a friend, as you and I do so often, catching up. There are so many benefits of moving your body in any form. Maybe not everybody's able to go to a structured 45-minute trainer instructed workout. Maybe you can do something for 20 minutes. Like I have patients who unfortunately aren't able to go to a gym. So a couple of things I've done is about 20-minute workouts. Can we do 20-minute weight training with four, weights at home? Like invest in four good weights. I have a bunch of physicians at the place I work that I see as patients who are not able to be as active because of the nature of what they do. They're not as active. So can they do something in their office every hour for about 10 to 15 minutes, or even like 2 minutes of, jumping jacks or take some weights? I mean, just creating those kind of things at work gets people going.
I think that's the hard part. I had to really shift my mindset too. Like when that study came out about squats. So there's a study that shows that if you're not able to walk or exercise during the day, if you do squats every 45 minutes for just like about a minute of squats for an 8-hour day, it's even better than if you took a single 30-minute walk for blood sugar. For example, insulin, they looked at blood sugar responses. And to me, like that was so eye-opening. It's just a reminder that like I have these weights in my room and I'm like, oh, I could just like, this was done with air squats, so you could do it anywhere.
Right.
But like, even if you had a couple of minutes, if you had 2 minutes, if you had 1 minute, there's still something that you can do. And I think that has been something very new that I've just learned for myself, like those exercise snacks. And that's really something that everybody can do. Like, who can't do air squats for 45 seconds in between their workday? And I thought that was so empowering. That's something so simple.
Is. And I think weighted vest is another
Yeah.
one. I have a couple of patients I see at the hospital. They both are nurses, and they were working on their weight and their abnormal blood sugars. They had pre-diabetes as their diagnoses. And one of the things they did was just started to walk around with weighted vest every day at work, and started taking stairs instead of elevators. Just two things at workplace. And that has actually helped them not only lose a certain amount of weight, but has dropped their blood sugars from a pre-diabetic range to a diabetic range.
Wow.
And this is with minimal dietary changes. I mean, it would be great if they're able to also make nutritional changes, but just given their lifestyles as young moms, it's hard. But just those two things have impacted their blood work, as well as their energy levels and their weight. And I feel like it's such a contagious cycle when you see the impact of small, actions. I do think people are then motivated to doing something more and a little bit more. It's almost like you enjoy the effects of, something as little as walking around with the vest.
Yeah. I've had to take a break from my vest because I think I wore it too much, and like my neck and shoulders feel a little stiff. And so I was like, I don't know if it was the vest or just overdoing it. And so that's one caution I would say to people is like, maybe don't overdo it the first time. This was not the first time, but it was the first time I wore it like a lot during the day.
Also, weight. I think what
Yeah.
happens is people, when you're getting
Overdo it,
on Amazon, yes, you get like 20 pounds because you
Yeah.
think 20 pounds is not. Actually, that can cause neck strain
Yeah.
and neck sprain.
Yes.
So like you said, I think, start very, very small and
take
just few
breaks.
hours.
Yeah.
Yes, it doesn't have to be all day, every day,
Yeah.
just few hours a day.
No, I love that. Okay, shifting gears. It's almost 2025.
Yes.
And I think this might be coming out in early 2025. Do you have resolutions? Or do you
I'm
have
not-
things that you're going to be working on in 2025?
Yes, I do. I don't necessarily have resolutions, but I absolutely know what I'm not going to do.
Okay.
So at the end of every year, I do reflections on what worked and what did
Yeah.
not work. And I feel like I have a good sense of what hasn't worked for me in 2024. And I'm hoping that I don't repeat those patterns in 2025.
Are you willing to share any of those?
Oh, absolutely. So I think overcommitting to things, I
Yeah.
think we were talking about this earlier, temptations, distractions. So it is very tempting when you get invited and when you are, when you have so many options to, for example, conferences. I think I
Yeah.
overdid conferences this past year. And as much as these conferences, women in medicine conferences, are helpful to me, I do have to pin them down to one or two for next year.
Yeah.
It was a lot of time away from my family. It was a lot of time away from even work and things I can do in town. So I think I'm definitely going to work on not overcommitting on that front. I also think I felt a little bit like I was spinning, not having a focus. I had too many things that were happening around me. I had too many projects at work with students. I'm publishing a couple of things. I'm working on those projects. Just way too many things. So I'm going to narrow it down to one or two and not commit to any until I finish the first two. As you know, David's about to go to college. So I think I have 6 months with him. And I've always been very protective of my time with my boys and with my family. One of the reasons I'm very careful in expanding any aspects of my career is that time with my children, because I look at that time as I have temporary job with my boys.
Yeah.
'Cause that's not a permanent job. They will be flying off the nest very soon. And while I'm doing that job, I want to be very, very present and very mindful. So I think I've always guarded that. But this past year felt like I had sort of gotten out of control with commitments, projects, social events. And I definitely know that that needs to be one step backwards.
Yeah. I think that's a really great realization. I think honestly, I've felt, you know how we talk about like you can't do it all the time?
Right.
I felt it never more have I felt it than this year. And so what I try to do, what I want to do more of in 2025 is like really lean into that. Like you can't do everything all the time, but you can pick like, for example,